Welcome back to the Mountain Morning Show. Well, that was a little inside look at the Impact Club at Park City High School, but now I have the experts here to talk more about the Mental Wellness Health Alliance here at Summit County. That covers everywhere from?
That's everywhere from Hennifer all the way down to Francis. It's really a countywide initiative where we have partners from all 3 school districts, from the municipalities all throughout this county, as well as locals and parents getting really engaged.
So Aaron Newman, by the way.
Correct.
Tell me your role.
So I help coordinate the efforts of the county when it comes to mental health and substance abuse programming, as well as sort of leading the efforts of the Summit County Mental Wellness Alliance. The role of the Alliance in the community is to really be that partnership group that implements the strategic plan for mental health and substance abuse that the County Council approved in November 15th.
Tell me, how did you come up with the plan?
Really, it was over 120 individuals from the community from all over the county sitting around a table identifying what are those key issues we need to address, identifying 5 critical priorities, and then working collectively to say, here's how we're going to make these happen. So here's all of our objectives. What's key to it is we have about 7 committees that are working as a community effort to address each one of these 5 specific areas.
What are the 5 areas? Do you mind me asking?
So we're looking at how do we improve access to mental health and substance abuse services and care within our county.
Okay.
Next is how do we ensure that we have prevention education programs within our schools, and something that a great partnership with Ben and the Park City School District, as well as North Summit and South Summit School Districts. Then also, how do we make sure that what we're doing is sustainable, that this just isn't a flash in the pan, that we have full community support ongoing with this. The next is our reintegration. So how do we work with individuals that are either recovering or undergoing treatment for mental health or substance abuse and get them back into our community and into everyday lives?
Wow, you really hit all areas.
We do, and then our final one is how do we make sure everything we're doing is also accessible to our Latino community, that we have programs in Spanish, services in Spanish.
That's awesome. Well, this is a plan that's been long in the works, finally approved. What
Yes.
are the next steps for you guys now?
The next step is now the real work starts. The committees have already begun working to identify what can we move forward with. So we have the access group actually is working for what's called a clubhouse model. So it's how can we have an area where individuals on the recovery and reintegration area can learn some vocational skills to sort of relearn what it is their passion in life and then move forward back into the community.
Interesting. Well, we should probably talk about some of these statistics. Why are we talking about this in Utah? Some of these, you guys gave me this nice little sheet, thank you. But it says 136% increase in suicides among young Utah youth aged 10 to 17 between 2011 and 2015. We're trying to figure out why.
We are, and I think what's good about this, while this is a sobering report that came out, it focused on those 150 deaths based in the community. And what we have to remember is this is not some abstract study.
No.
This was individuals' children, this was grandchildren, great-grandchildren.
They're Park City students.
Exactly.
I mean,
friends and peers.
Yeah.
So how we address this is going to be really key. One of the things that I like to caution about this report is the CDC did an incredible job with creating it, but they even acknowledged that there are some limitations to the data in this report. When we look at it, that 136 is a very powerful number.
Right.
Here in Summit County, we only saw approximately about a 3% growth during that time. Where we're ahead of the curve on this, the county and the community already recognized this as an issue and began work with the strategic plan. Then also within the schools, they had begun work on suicide prevention as well as the greater community.
Let's talk about the schools. Ben, you're involved, you're a psychologist, you work with the counselors and the teachers who work with the students directly, is that right?
That's right.
Tell me what you do, what your role is.
So my role is, it's actually a new role this year. They brought me in this year because Park City recognizes, Park City School District, we recognize the clear correlation between student outcomes as far as what our school district targets, which is academics and high graduation rates and everything else. We cannot, those are not mutually exclusive from mental health and behavioral issues that we face in the schools. And so, I mean, props to Park City School District for making this such a priority and saying, hey, look, you know, we've got to get somebody in here to get involved with our kids. And our counselors are awesome. We have social workers now in elementary schools that are helping as well.
Wow.
And a really incredible partnership with Valley Mental Health and Doty. So our goal is to get students access to those, as Aaron said, identify them early, get them involved at a young age, focus on substance abuse, any kind of prevention and mental health awareness. And a lot of what we're also trying to do, and we work with communities that care and connect, and a lot of really great community agencies here, is to help just destigmatize mental health, as our Impact Club talked about, you know, at Park City High School. So we've got a lot of really cool stuff going on to get ahead of this, and hopefully, you know, get some sort of see some benefit with not just student outcomes, but also, you know, obviously access to better mental health services.
Right. Well, I have more questions in general for you guys, but Dodie, let's talk about you. You're on the your community side.
Exactly. So, right, this is a really concerning study, and we work really closely with the state of Utah, DSAMA, the Department of Substance Abuse and Mental Health, and they did recognize several years ago that suicide was on the rise and a very big concern for the state of Utah especially. And they actually started a prevention program called Zero Suicide that we're a part of for Valley Behavioral Health for Summit County. And part of that initiative is really looking, when you look at youth, you look at risk factors, and then you look at protective factors. And what we want to do in Summit County as well as the state, we want to reduce the risk factors for youth, and we want to encourage and increase the protective factors. And protective factors include, but not limited to, connections. So family support, family connections, community support. That's why we're all here today. Community connections, school and peers. Those are the top 4 protective factors that did come out of this study. And so it is really important. We have a school-based program. We're in the school. We're working with Park City District, North Summit, South Summit. And also, as Ben talked about, the wraparound care is so important. So we want to get caseworkers, we want to get school counselors, we want to get the parents, we want to get friends. I love all of the youth groups that are starting, and the CTC program that started this year that we were all a part of, and one of the committees that Aaron talked about. It's so important to get more people involved and to destigmatize mental health, mental illness, behavioral health, substance abuse. Because when we feel shameful about these topics, then we don't talk about them. And then it makes it difficult to identify suicidal ideation.
Right.
If we can help and work as a community to destigmatize, then it's okay to talk about these things. We can identify them sooner and get help where help is needed a lot sooner.
Interesting, and you guys are really trying to spread that message throughout the whole community.
Exactly.
Interesting. Well, I love how you guys are coming together. Schools, community, the Alliance. I mean, really, you guys are coming together for the county, and it seems to be working. I do want to go to commercial. We're kind of running a little bit late on time. I want to talk about some general questions about why you think there's a rise. I want to talk about a controversial aspect that you guys just proved me wrong. So if you guys can stick around, I'd love to talk some more.
Sure.
Absolutely.
Great. All right, we'll be back in just a few minutes. Welcome back to the Mountain Morning Show. We're still talking mental health awareness. I have all the experts here from the Alliance, from the schools, from the community, the Valley Behavioral Health. How are you guys doing? Are you guys okay with sticking around and talking
Great.
some longer?
I think so, yeah.
Very comfortable couch. I'm happy. I'm happy to hang here as long as I need to.
It's not too bad. Well, okay, this is a new study basically saying that Utah is way above average versus the national rates of suicide among youth. Why do you think that is?
I think there's a lot of different causes. When it comes to suicide, there's really no clear indicator that that you can check off, say, okay, I see this in my son or my daughter, I need to be really concerned about suicide. There's a lot of preliminary warning signs, but nothing says, well, this one thing is going to be leading to suicide.
Right.
And I think when you look at all those, like Dodie talks about a lot in her work, there's risk factors and protective factors that really can help parents as they're working with their youth. One thing that came out of the report, though, which was really, to me, kind of a warning bell, it identified 15-year-olds as the #1 age group in Utah to consider suicide. And that right there kind of then puts a lot of onus on the schools to see how can they get engaged with that age group.
Is 15 9th grade, 10th grade?
Yeah, 9th,
10th grade,
10th,
so that's
yeah.
high school, right? Because isn't junior high 9th grade here?
Yes. Yes.
Interesting. So it's kind of like a transition period between junior high and high school. So what kind of factors are people trying to look into with these studies?
Do you want to talk about the schools or
Sure.
the
Well,
kids?
what we look for, one of the biggest things that we are working with our Impact Club, and we also have a Hope Squad that they are trained in QPR, which we can get into. That's the question,
Persuade,
Persuade,
refer.
refer, in targeting suicidal ideation or suicidal risk. But one thing that we really target is, instead of these big picture, hey, are you depressed? Let's get you talking with a therapist.
Yeah.
Look for that kid who doesn't have anybody to sit with at lunch. Look for that kid that just is kind of a loner, and or who knows, you know. That's a risk factor. That's something we need to look at. But there are also a lot of really social, gregarious, outgoing kids that are struggling with it too. So we know there's not a lot of correlation as far as grades. We have high achieving students that struggle with it. We have low achieving. We have substance abusers and non-substance abusers.
Interesting.
So the real important thing that we need to do is that our students, our teachers, community members, that we all recognize that when someone does say any kind of a reference to suicidal ideation, we take it very, very seriously.
Even if they think they're joking about it.
Absolutely. We oftentimes will think, oh, they're joking, or oh, you're just trying to tell me that you're upset. And the thing is, 999 times out of 1,000, we're probably right. But do we want to be wrong that 1 in 1,000 times?
Right.
And absolutely not.
Well, it doesn't make it easier. Like you said, it's so complex. You can have high achieving, jocks who are dealing with depression, or you can have the kid who sits alone at lunch dealing with the same exact thing. It's hard to target these people and help them. What about you, Jody?
Well, so I was just going to add in, I love what Ben was saying, and that's why we always want to talk about it.
Right.
Because depression and anxiety, a lot of depression and anxiety that we all deal with is really normal and natural. But if we feel ashamed of it and we don't talk about it, it can get worse. We don't always need therapy or medication, not all the time. But if we do, then we want to be open to that, and we want to destigmatize.
Yeah, we don't want to think that's a negative thing to have to go talk to somebody or have to have a prescription.
Right, and that's why I love all the great things that the schools are doing, getting the peers, getting kids involved together to support each other. That is huge. Because if I'm a youth and I'm having a really bad day, the number one thing that helps me is to talk about it with somebody else that understands. So that's one of my peers. And definitely having good family connections. And we know that turmoil happens, that's normal and natural too. And so sometimes there may be short-term therapy that may be helpful, just some family sessions to get everybody kind of talking through some things and just learning some skills and strategies can always be helpful too.
Well, it seems like there could be less pressure too if you're just talking with your family and friends versus, I'll sit down on the couch with my therapist.
Right.
Well, it's a great point, because sometimes, especially a teenage kid thinks, oh, I'm crazy.
Yeah.
Why are you having me talk to this person? Maybe something really is wrong with me, And again, there's that stigma piece.
Right.
And so the more we can talk about it, just be open with it and recognize, listen, this is a long-term solution to a short-term problem. Let's talk about it and recognize that this is kind of a normal thing that people go through, and the only way to get through this is to rely on the support that we have.
We know that one of the main reasons for substance abuse and substance use is also to deter from really feeling those feelings or talking about those things. And it's a strategy, right? It's not a great, healthy strategy, but it is a strategy that we use. And so we want to get away from using that strategy and get more toward talking about things and relieving anxiety and stress and depression through talking about it and learning great, healthy coping skills rather than using substance abuse and use that can lead to addiction.
And trying to avoid it, which really can just make it a lot worse.
Well, it makes everything worse.
Oh, I'm sorry.
Yeah.
And that's one thing we've really focused a lot on with our teachers, and I would definitely want to throw this out there to parents as well. If your child does come to you talking about this, sometimes we go into this mode of, well, let's just fix it. Well, let's get you up skiing. You always feel great when you're skiing. Let's go for a walk. Let's, do something. The best thing we can often do if they come to us with these big feelings or these big, issues they're struggling with, is we just say, we talk about the emotion of it and not the actual content of it. So we say, I am so sorry that you're feeling so terrible. That has got to be really, really awful. How can I support you?
Rather than what is called, explain.
So rather than, oh, really? Well, okay, well, let's go talk to your teacher. It must be this class that's stressing you out. So if we can,
Okay.
and let's lay out a homework plan for you so you're not so stressed out by your homework. And that's good, that's helpful. But really what a student needs in that moment is to understand that their feelings are valid and that their struggle is real.
And it's normal.
And it's normal. So you just say, I am so sorry you're feeling that way. You know, one of the worst things that we can say as parents or teachers that we sometimes think is supportive, but it's actually incredibly invalidating is, you know what, this is just a tough time. You know, adolescence is hard.
You'll get over it.
You'll get over it. And in a few years, you'll look back at this and you'll just laugh. Well, to them, in this moment, it's real, and our perception is our reality. And so it's just, we have to always validate that and just say, I'm so sorry. How can I support you?
Interesting. Well, that's really good tips for parents. What else can parents do? There's a new app.
There is. So one of the things I really encourage all parents and everyone in the community to get, it's called the Safe UT app. It was created by the University Neuropsychiatric Institute down at the University of Utah. And it's an incredible tool for parents or for youth. We're happy to say now all 3 school districts are enrolled in the program.
Cool.
So if a student has concerns about one of their peers, they can do an anonymous tip and someone from the administration will check in on that student.
What an easy and fast way to get the word out.
It's a great way. And another part too for parents or individuals, it has instant connection to the UNI's suicide hotline, as well as you can text with someone down there if you don't want to be talking to someone. A lot of times we'll hear from youth that they're in class, they're really feeling, they're struggling with feelings going backwards and forward and back on what they want to do, and they can pull out their phone and text back and forth with someone.
Well,
and
texting's
find
more
that help.
comfortable too, right? Because
It
you
is.
don't have to go face to face. You don't have to feel the pressure of someone responding to you, like
Yep.
you and I are talking.
And it's a free app. It's available at the iTunes store as well as the Android store, and we really are encouraging everyone, whether you're youth or you have a child or you don't have a child, this is a powerful tool for everyone to have, that if you come across someone, even if you have concerns, hand them your phone, let them use that app, get that direct connection.
And it's called Safe UT.
Safe UT.
Awesome resource for parents. Well, guys, thank you so much for the tips. I feel like we've covered a lot. Is there anything else you do want to cover? You're like,
Be careful what you ask for, because I can talk about this stuff all day long. So.
No, I think one thing, if anyone wants to get involved, whether it's a parent listening to this or a community member, the more people we have engaged with the strategic plan with the Alliance, the better. We don't have a limit on membership, or there's no fees or anything. Just give us a call at the health department. We'll talk with you and find, is there a committee that really meets your passion?
what about a website?
In the works.
In the works?
In the works.
Good to know. All right, let us know when there is one. We'll always mention it on the show.
Will do.
All right, guys, thanks so
Thank
much
you
for
so
joining
much.
me this
Thank
morning.
you.
Thank you.
Really important topic. All right, we're going to wrap up the show right after this commercial break.